Hi, my name is Grace Briantis. I am a Saginaw Valley State University student in the Family Nurse Practitioner program, and I'm here to do a peripheral vascular assessment. So I would start by looking at the size, symmetry, shape of the arms. So they are the same shape, they are the same size, there is no swelling in them. I would look at the nail beds, the hands, and they are pink in color. The hands are appropriate color. There's no cyanosis, pallor. Then I would look at both of the arms on the front and the back for any veins that are protruding out, which I don't see. I would come down to the legs and inspect the nail beds. Are pink in color. There is no swelling, there is no edema, there are no rashes, lesions. They appear to be symmetrical. They are the same shape. There is no swelling. So I don't see any protruding viscosities anywhere. I also would look posteriorly and laterally of the legs. It's a little difficult to do, but I would do that. And then I would come back to the palpation. I would palpate from the fingertips up to the shoulders. So I would check for cap refills, which are less than 3 seconds. Any pain when I palpate the hands? Okay. I would palpate the arms. Any pain when I palpate the arms? Right. So I will check the radial pulses. Those are equal and 2+. Then I will check the brachial pulses. Those are also 2+. I will have the patient flex their hand to check the epicondral nodes, 90-degree angle, and I would place my fingers 3 centimeters from the medial epicondyle in between the bicep and the tricep muscle and palpate. And there is no node that is palpable there, which is normal. I also would do that on the other arm, which I'm not going to do for time's sake. Then I would come down to the pulses of the lower extremities, and we go from the groin down when checking the lower extremities. Typically I would have the patient laying in a supine position on a bed to feel the pulses, but for this sake we're just going to have them sitting in the chair. So I would check the femoral pulses, which are palpable, and then I would do the superficial inguinal nodes, which those are palpable. I would check the popliteal pulses, which are about a +1, which is normal. Popliteal pulses are a little harder to find. Then I would do the dorsalis pedis, and the posterior tibial, and both of those are 2+. I would also check the cap refill of the toes, which are less than 3 seconds. I would feel for temperature of the legs and the feet, and temperatures even, warm, dry. The temperature of the arms, warm and dry. And I didn't feel any nodules, lesions of the legs. And there isn't any edema, but if there was edema, I would press down in the area of edema for at least 5 seconds. And then, depending on how long it took the skin to go back to its normal form, I would grade the edema. And that's it.